Welcome to Howard Brown Barber and Beauty Institute. Today we are doing the review for disorders and diseases of the skin. Let's begin. What term is used to describe any mark, wound, or abnormality? Is it lesion, papule, cyst, or skin tag? If you chose A, lesion, you are correct. What is leukoderma? Flat, hairy spots on the skin, light patches caused by destroyed pigment-producing cells, brown or wine-colored discoloration, thick scar resulting from excessive fibrous tissue. If you chose B, light patches caused by destroyed pigment-producing cells, you are correct. What is the term for a flat spot or discoloration of the skin, such as a freckle? Pustule, cyst, macule, stain. If you chose C, macule, you are correct. What is true of malignant melanoma? It is a benign form of skin cancer. It is the least serious form of skin cancer. It is the most serious form of skin cancer. If you chose D, it is the most serious form of skin cancer, you are correct. What condition is also known as melasma? Hyperpigmentation, hypopigmentation, benign melanoma, malignant melanoma. If you chose A, hyperpigmentation, you are correct. What is an example of epidermal cysts? Scars, milia, boils, blisters. If you chose B, milia, you are correct. What is another name for the acute inflammatory disorder malaria rubra? Is it prickly heat, scabies, rabies, shingles? If you chose A, prickly heat, you are correct. What term refers to a pigmented nevus? Is it nodule, vesicle, papule, mole? If you chose D, mole, you are correct. What are nodules? Brown or wine-colored discolorations, small bumps caused by conditions such as scar tissue or infections, large blisters containing watery fluid, clusters of boils. If you chose B, small bumps caused by conditions such as scar tissue or infections, you are correct. What is another name for a nevus? Is it carbuncle, wheal, birthmark, skin tag? If you chose C, birthmark, you are correct. What is a tubercle? Is it open lesion on the skin or mucous membrane of the body? Abnormal, rounded, solid lump larger than a papule? Yeast infection of the skin that inhibits melanin production? Another name for the contagious infection called ringworm. If you chose B, abnormal, rounded, solid lump larger than a papule, you are correct. What is tinea versicolor? Is it pigmentation disease characterized by white patches? Yeast infection of the skin that inhibits melanin production? Generic term for any kind of fungal infection? Severe oiliness of the skin? If you chose B, yeast infection of the skin that inhibits melanin production, you are correct. What is the common name for the contagious infection tinea corporis? Is it ringworm, shingles, rabies, scabies? If you chose A, ringworm, you are correct. What is the generic term for a fungal infection? Is it malaria, tinea, verruca, Barber? If you chose B, tinea, you are correct. What is the scientific term for Couperot's skin? Is it tinea barbae, tinea pedis, telangiectasia, pseudofolliculitis? If you chose C, telangiectasia, you are correct. What causes the skin to tan upon exposure to ultraviolet UV radiation? Increase in pigmentation, increase in blood circulation, increase in lymph production, increase in body temperature. If you chose A, increase in pigmentation, you are correct. What is a stotoma? Is it brown or wine-colored discoloration, sebaceous cyst of subcutaneous tumor filled with sebum, brownish spot ranging in color from tan to bluish black, small, benign outgrowth of the skin that looks like a flap? If you chose B, sebaceous cyst of subcutaneous tumor filled with sebum, you are correct. What is the term for a brown or wine-colored discoloration? Is it wen, wheal, tan, stain? If you chose D, stain, you are correct. What is a characteristic of the form of skin cancer called squamous cell carcinoma? Is it pearly translucency to fleshy color, scaly red or pink papules or nodules, dark purple splotches at the joints, asymmetrical area and color variation? If you chose B, scaly red or pink papules or nodules, you are correct. What are skin tags? Is it small, benign outgrowths of the skin that look like flaps, dangerous manifestations of malignant melanoma, thick scars resulting from excessive fibrous tissue, decaying discharges from infected comedones? If you chose A, small benign outgrowths of the skin that look like flaps, you are correct. What is rosacea? Is it any skin with a naturally rose-hued color, condition characterized by redness and dilation of blood vessels, light-colored raised mark on the skin formed after injury, skin cream used for treating fair-skinned clients? If you chose B, condition characterized by redness and dilation of blood vessels, you are correct. What is the term for flaky skin cells or any thin plate of epidermal flakes, dry or oily? Is it vesicles, scales, skin tags, papules? If you chose B, scales, you are correct. What is a light-colored, slightly raised mark on the skin that is formed after an injury or lesion of the skin has healed? Is it stain, scar, tan, or wheal? If you chose B, scar, you are correct. What are sebaceous filaments? Is it mainly solidified impactions of oil without the cell matter, light-colored, slightly raised marks on the skin formed after injuries, thin plates of epidermal flakes such as excessive dandruff, small clusters of papules caused by products used on the face? If you chose A, mainly solidified impactions of oil without the cell matter, you are correct. What is an example of sebaceous hyperplasia? Is it benign lesions frequently seen in oilier areas of the face, solidified impactions of oil without the cell matter, light-colored, slightly raised marks on the skin formed after injuries, patches covered with white-silver scales? If you chose A, benign lesions frequently seen in oilier areas of the face, you are correct. What is acne? Is it medical condition defined by an absence of melanin pigment, chronic inflammatory skin disorder of the sebaceous glands, excess inflammation from allergies and irritants, foul-smelling perspiration, usually in the armpits or feet? If you chose B, chronic inflammatory skin disorder of the sebaceous glands, you are correct. What is acne excoriae? Is it severe form of acne that is considered precancerous, Skin type of anyone who regularly gets acne lesions. Product that makes acne lesions vanish instantaneously. Disorder where clients purposely scrape off acne lesions. If you chose D, disorder where clients purposely scrape off acne lesions, you are correct. What are actinic keratosis? Is it large blisters containing watery fluid that are similar to vesicles, clusters of boils, pink or flesh-colored precancerous lesions that result from sun damage, closed, abnormally developed sacs? If you chose C, pink or flesh-colored precancerous lesions that result from sun damage, you are correct. What is albinism? Is it deficiency in perspiration, dry, scaly skin resulting from sebum deficiency, foul-smelling perspiration, medical condition defined by an absence of melanin pigment? If you chose D, medical condition defined by an absence of melanin pigment, you are correct. What is anhidrosis? Is it deficiency in perspiration, excessive perspiration, foul-smelling perspiration, bloody perspiration? If you chose A, deficiency in perspiration, you are correct. What is esthetosis? Is it medical condition defined by an absence of melanin pigment, dry, scaly skin from sebum deficiency, excess inflammation from allergies and irritants, disorder where clients purposely scrape off acne lesions? If you chose B, dry, scaly skin from sebum deficiency, you are correct. What is the term for excess inflammation, dry skin, redness, itching from allergies and irritants? Squamous cell melanoma, contact dermatitis, atopic dermatitis, basal cell melanoma. If you chose C, atopic dermatitis, you are correct. What is true of basal cell carcinoma? Is it is the least common type of skin cancer? It is the least severe type of skin cancer? It is the most serious type of skin cancer? It is a benign form of skin cancer? If you chose B, it is the least severe type of skin cancer, you are correct. What is the term for foul-smelling perspiration, usually in the armpits or on the feet? Is it tinea pedis, bromhidrosis, asthiatosis, tinea barbae? If you chose B, bromhidrosis, you are correct. What is a bulla? Is it mass of hardened sebum and skin cells in a hair follicle? closed comedone, open comedone, large blister containing fluid that is larger than a vesicle. If you chose D, large blister containing fluid that is larger than a vesicle, you are correct. What is hyperkeratosis? Is it overproduction of pigment, underproduction of pigment, thickening of the skin caused by a mass of keratinized cells, thinning of the skin caused by a lack of keratinized cells? If you chose C, thickening of the skin caused by a mass of keratinized cells, you are correct. What is the term for the overproduction of pigment? Is it hyperpigmentation, superpigmentation, metapigmentation, hypopigmentation? If you chose A, hyperpigmentation, you are correct. What is hypertrophy? Is it abnormal growth, normal growth, abnormal perspiration, normal perspiration? If you chose A, abnormal growth, you are correct. What is hypopigmentation? Is it excess of pigment, injection of pigment, surgical removal of pigment, lack of pigment? If you chose D, lack of pigment, you are correct. What is impetigo? Is it light, abnormal patches that are the result of congenital defects, scar tissue resulting from excessive growth of fibrous tissue, contagious bacterial infection marked by clusters of small blisters, redness and bumpiness in the cheeks caused by blocked follicle? If you chose C, contagious bacterial infection marked by clusters of small blisters, you are correct. What is a thick scar resulting from excessive growth of fibrous tissue, collagen? Is it stain, keloid, wheal, wen? If you chose B, keloid, you are correct. What is a keratoma? Is it thick scar resulting from excessive growth of fibrous tissue, open comedone, closed comedone, acquired thickened patch of epidermis? If you chose D, acquired thickened patch of epidermis, you are correct. What are abnormally thick buildups of cells? Is it keratosis, keloids, vesicles, papules? If you chose A, keratosis, you are correct. What is keratosis pilaris? Is it acquired thickened patch of epidermis, redness and bumpiness in the cheeks caused by blocked follicles, Most malignant form of skin cancer. Least malignant form of skin cancer. If you chose B, redness and bumpiness in the cheeks caused by blocked follicles, you are correct. What is the scientific name for a freckle? Is it vitiligo, macule, melasma, lentigo? If you chose D, lentigo, you are correct. What are secondary lesions? Is it benign outgrowths of the skin that look like flaps, skin damage that changes the structure of tissues or organs, thick scars resulting from excessive growth of fibrous tissue, brown or wine-colored discolorations? If you chose B, skin damage that changes the structure of tissues or organs, you are correct. What is seborrheic dermatitis? Is it rare form of rosacea, common form of rosacea, rare form of eczema, common form of eczema? If you chose D, common form of eczema, you are correct. What is severe oiliness of the skin called? Is it dermatitis, seborrhea, eczema, rosacea? If you chose B, seborrhea, you are correct. Where in the face does the acne-like condition perioral dermatitis manifest? Is it forehead, chin, nose, mouth? If you chose D, mouth, you are correct. What is a characteristic of primary lesions? Is it brownish spots ranging in color from tan to bluish black, subcutaneous tumors filled with sebum, infection with ringed red pattern with elevated ridges, flat, non-palpable changes in skin color such as maculae or patches? If you chose D, flat, non-palpable changes in skin color such as maculae or patches, you are correct. What is the term for persistent itching? Is it dermatitis, pruritus, hepatitis, mitosis? If you chose B, pruritus, you are correct. What is the common name for pseudofolliculitis? Is it skin tags, razor bumps, freckles, pimples? If you chose B, razor bumps, you are correct. What is a characteristic of psoriasis? Is it red patches covered with white silver scales, subcutaneous tumors filled with sebum, flat, non-palpable changes in skin color, such as maculae or patches, benign outgrowths of the skin that look like flaps. If you chose A, red patches covered with white silver scales, you are correct. What is a pustule? Is it inflamed wheal, irritated wen, irritated vesicle, inflamed papule? If you chose D, inflamed papule, you are correct. When someone has retention hyperkeratinosis, what builds up and fails to shed from the follicles as happens in normal skin? Is it sebum, dead skin cells, perspiration, hairs? If you chose B, dead skin cells, you are correct. What is the term for a cluster of boils? Is it wheal, wen, comedone, carbuncle? If you chose D, carbuncle, you are correct. What is the common name for chloasma? Is it razor bumps, skin tags, liver spots, fine wrinkles? If you chose C, liver spots, you are correct. What is true of comedogenic product? Is it has no adverse effects on the skin whatsoever. It tends to clog follicles and cause a buildup of dead skin cells. It helps clear up comedones quickly and safely. This sort of product should not be used on human skin. If you chose B, it tends to clog follicles and cause a buildup of dead skin cells. You are correct. What is comedone? Is it cluster of boils, large blister containing watery fluid, mass of hardened sebum and skin cells in a hair follicle, pink or flash-colored precancerous lesion? If you chose C, mass of hardened sebum and skin cells in a hair follicle, you are correct. What is the common name for the very contagious infection, conjunctivitis? Is it ringworm, pink eye, rabies, scabies? If you chose B, pink eye, you are correct. What is contact dermatitis? Is it foul-smelling perspiration? The effect when two skin disorders connect with each other. An inflammation caused by contact with a substance or chemical. Excessive perspiration. If you chose C, an inflammation caused by contact with a substance or chemical, you are correct. What is crust an accumulation of? Is it sweat and dirt, water and salt, blood and lymph, sebum and pus? If you chose D, sebum and pus, you are correct. What is a closed, abnormally developed sac containing fluid, infection, and other matter above and below the skin? Is it vesicle, cyst, comedone, papule? If you chose B, cyst, you are correct. What is dermatitis? Is it excessive oiliness of the skin, excessive dryness of the skin, any cancerous condition of the skin, any inflammatory condition of the skin? If you chose D, any inflammatory condition of the skin, you are correct. What type of physician specializes in treating skin disorders and diseases? Is it dermatologist, physiologist, esthetician, cosmetologist? If you chose A, dermatologist, you are correct. What is a papule? Is it another name for the skin malformations called birthmarks, tumors caused by conditions such as scar tissue and infections, small elevation of the skin that contains no fluid and may develop pus, itchy, swollen lesion caused by a blow, insect bite, or sting? If you chose C, small elevation of the skin that contains no fluid and may develop pus, you are correct. What are not examples of wheals? Is it hives, mosquito bites, urticaria, pustules? If you chose D, pustules, you are correct. What is vitiligo? Is it contagious skin condition, allergic reaction to strong chemicals in cleaning products, total absence of pigmentation, pigmentation disease characterized by white patches? If you chose D, pigmentation disease characterized by white patches, you are correct. What is a small blister or sac containing clear fluid? Is it vesicle, carbuncle, melanoma, wen? If you chose A, vesicle, you are correct. What is the common name for the hypertrophy of the papillae and epidermis known as a verruca? Is it wheal, wart, wen, wick? If you chose B, wart, you are correct. What is another term for varicose veins? Is it primary lesions, vascular lesions, secondary lesions, foreign lesions? If you chose B, vascular lesions, you are correct. What is the term for vascular dilation of blood vessels? Is it cardiodilation, pulmodilation, plasma dilation, vasodilation? If you chose D, vasodilation, you are correct. What is the common name for urticaria, which is caused by an allergic reaction from the body's histamine production? Is it pink eye, ringworm, scabies, hives? If you chose D, hives, you are correct. What accompanies an ulcer in addition to a loss of skin depth? Is it pus, blood, lymph, sebum? If you chose A, pus, you are correct. What is the term for an abnormal cell mass that results from excessive cell multiplication and varies in size, shape, and color? Is it tumor, comedone, skin tag, razor bump? If you chose A, tumor, you are correct. What is eczema? Is it pigmentation disease characterized by white patches, inflammatory, painful, itching disease of the skin, yeast infection of the skin that inhibits melanin production, contagious infection that forms a ringed red pattern? If you chose B, inflammatory, painful, itching disease of the skin, you are correct. What is edema? Is it any inflammatory condition of the skin, swelling caused by a fluid imbalance in cells, brownish spot ranging in color from tan to bluish black, closed, abnormal